So we have to go back to the biology of this disorder, right? This is a progressive genetic medical illness. And so as people progress in this illness and it gets more and more severe, it becomes less and less possible to actually just stop. And it's unfortunate that the most widely believed thing in the country is that this is just a pure choice that people make, that they enjoy it so much they won't stop, that they won't stop until they're ready to make a choice to stop, and that they have to make that choice, and it's just not worth it. In other words, they're not making the right choice because apparently it's not worth it enough to them yet, right? These are widely held beliefs. And I've seen family that come in and they're like, well, if you loved me, you would do this, right? It implies that there's nothing in their lives that's motivating enough to get them to do it. So I want to back up with a bit of biology and talk about why none of that is true. By the time your disease has progressed, it's a compulsion. You have lost so many precursors because your gut health is so poor, because alcohol wipes out the healthy gut lining, that you're not absorbing food properly. So you don't have the precursors that you need to make serotonin and dopamine in your brain. You are not creating the neurotransmitters to make your brain function healthfully. And that's why you end up having anxiety, sleep disturbances, depressive symptoms, many, many symptoms that come as a result of that. Trouble with memory eventually, right? All of these things come from that. When that's happening, it's also driving the compulsion to drink because your brain's on empty. And so it's trying to squeeze out the last bit of serotonin and dopamine. It can wring out of the brain every time. I can tell you that, I've treated over 130,000 patients through my 3 companies, right? So I've been doing this for a long time and met a lot of patients. And I can tell you that what they tell me is by the time the disease has progressed to that point, they are not developing euphoria anymore. Patients even using heroin, they could be using heroin 50 times a day. They no longer have euphoria from it. They don't feel, high and they're having a good time. Like if you never smoke pot, but you do on a weekend, you have your first experience, you feel high. They don't feel that. They don't have that sensation anymore. It goes away over time, and their brain eventually gets to the point where they're just using actually to feel normal. That happens with alcohol too. It happens with opioids. It happens with alcohol. It happens with most substances. They are using to reset their brain and make it function again, because what happens is over time, without the substance, their brain's not functioning. And they have to have it in order to function. They're wringing out the last bit of neurotransmitter they have, so they need it in order to function, right? That's a compulsion. Their brain's telling them you have to consume alcohol. They wake up in the morning and drink, some of them, right? So it's a real, this isn't a choice. This is something that they don't want to lose their kids, right? They don't want to lose their spouse. They don't want to lose their job. They don't want a DUI and have to go to court. No one wants these things. So this isn't actually about choice. This is about biology. When you say if someone's really ready, well, certainly a person has to be ready to say, okay, I'm ready to go into treatment. But let's talk about why people haven't been ready to go into treatment. I mean, maybe the reason people don't go into treatment when it's stage 1 or stage 2 is because the treatment options they've had until now have been so miserable, right? I mean, you have to tell your boss you're going to need a month off. Who asks for a month off, right? So your boss is going to know. So you're putting your job at risk. You're going to have your colleagues find out, very probably. You're going to feel exposed. You have to leave your children and your family. If you're stage 2, most patients aren't going to do that, right? They're not going to do it. It's too big of an ask, and people aren't going to disrupt their whole lives for a disorder that at that point is maybe 5 or 6 beers a day, just using examples. And then that means that the disorder progresses, and it gets to that point where there's a biological component now that's driving them with such compulsion that eventually they get to where they're drinking 24 hours a day. There's a huge progression that happens over the course of about, say, 8 years. So at towards the end, stage 3 and 4, those patients aren't making a choice. They don't have one. And I can't tell you how many patients have said to me, I was terrified before I found this program, I was terrified because I have young children at home. I can't leave for 30 days. It's not even an option. And I couldn't stop and I couldn't function. So I'd get my kids off to school in the morning. I would start drinking. I'd have to drink through the workday. I try to pace it out so that I can function as best as I can function. But then by the evening, the cravings are so off the charts that I drink really heavily until I pass out at night. And then I wake up sometimes 2, sometimes 3 in the morning, but every single night. And generally, I have to have another drink because I feel terrible again. I'm already having the jitters. So I have to drink again so I can get another 3 hours sleep, get up in the morning and start over. That's where many of our patients are at. This isn't a choice. They don't want to live like that, but they haven't had alternatives. They didn't have alternatives when making the decision to go to treatment, would have prevented it from getting this bad, that were doable. And they don't even have alternatives. They don't even have the option to go sometimes when it's really bad. So I would argue that they're not getting high. This isn't euphoria that's driving them. They're not so attached to the euphoria that, frankly, they're not feeling that they want to keep that euphoria to the neglect of all the other things in their life. They have a biological compulsion, and they don't have access to treatment at early stages that makes sense, that works, that helps them, and that is accessible and anonymous. So they don't go. So perhaps there are other factors, right, in the decision about what informs when people decide to go into treatment than just willingness. I think there's a lot more to it.